things. So when we're talking about the nucleus, maybe if we just bring the pony just a bit more side on for people. Yeah, perfect. Oh, Poppy, too far. Okay, we need to think about it in two fashions. So of course the funicular part of the nuchal ligament, I always remember which part is the funicular and what is the lamellar I always think that the fun part's on the top because that's the part you get to brush and braid and all that kind of stuff. So that's my little trick for remembering the two pieces of that nuchal ligament is on the top. And I see lots of people go through and do some assessment on the nuchal ligament. They end up bringing their assessment down into that rhomboid tissue, which I think is a little bit of a detriment when you're looking at the nuchal ligament. And they always forget about where the actual crepitus or fibrosis starts to come in with the horse. So if we look at the skull itself, our nuchal ligament is coming off that nuchal process right on the very back of the skull. When we are going to look and do an assessment on our nuchal ligament, we need to find that nuchal crest and we need to come in behind it. And we actually want to press that ligamental structure. And if you look at the skull itself, you can see that we've got a little barrier here, and that's the depth of that nuchal ligament coming down and attaching. So this was a 15-1 hand quarter horse, and you can see that that funicular part of that nuchal ligament is that thick on its attachment. Okay, so super thick, but also when we go to palpate into it, we can't just run our fingers on the top of here and think that we're actually getting an assessment of what's happening with that ligament structure itself. And when we talk through the biomechanics of this, we're going to realize that in osteopathy, they're going to tell us that whatever's happening at our atlantal occipital joint is going to be happening here at the front of the SI joint. And in layman's terms, they call that half-witted brother syndrome. You know, whatever you're seeing up there, the opposing problem is going to be happening down here. And so many body workers and trainers have so much trouble with the SI joint, and we work and work and work at the front of this pelvis. But I have to tell you that I've had more pelvic releases by making sure that I work through the front of that nuchal ligament than I have actually just focusing, if I have an SI problem, on that SI joint. So today we're going to just chat through how we're going to palpate that, but it's really critical. There's a couple studies out now. One's a 2016, I believe, so a little bit older, but a couple new ones telling us about, in performance horses, how much lesions that they're seeing in the actual attachment of that nuchal ligament. And so that is really important for us to look at when we are doing our palpation, and then we'll talk about that lamellar portion in a second. So when you go through, I usually like to use the little bit of a shake as I go down that nuchal ligament just to see if I feel anything. I'm really careful not to migrate down into the rhomboid region at all. I want to keep my fingers right at the very top of that. Even better way to do it is to use yourself the natural handle that the universe or God or whoever you believe in gave us. And that natural handle, if you pull on that mane, you'll actually get a little bit more of a dorsal ventral idea of what's happening in that nuchal ligament itself. And when you guys get a chance to pop up, or at the end of the session here, when you get a chance to pop up, when I went lateral through this horse, I've got pretty good movement all the way along. Maybe I've got a little bit of restriction here, but as soon as I go dorsal ventral, I've got a significant amount of restriction all through this lower portion, which kind of makes a little bit of sense. Now, pony being ridden by a kid, so we can't, get too judgy when we're looking at the amount of tissue that this horse is holding, but definitely has a drop through that mid-back. And we have a horse here that's not using her neck correctly as well. And we'll talk through that biomechanic in a second once we've talked through the lamellar portion of this nuchal ligament. I definitely want to see this in both a passive state and an active state. So because this is used as our passive system for the back, again, we'll talk through that in just a second, but when we're talking about our palpation, If you just feel this horse in a neutral state or a passive state, we're not going to get a full idea of what's happening with the ligamental structure. I would like to be able to take the pony and bring her to the side and re-palpate that along and redo my handle work all the way along. And same for bending her to the opposite side and redo and feel all the way along. If you don't add that active type of palpation, you will miss a lot of the lateral stability problems that are happening in a horse, okay? So if we start now talking just a little bit about what the, well, no, we better not. We better talk through the lamellar part first and then start talking about the mechanics of what the neck does, okay? So when you're doing your palpation on this, make sure you have a passive state evaluation and an active state evaluation, okay? If you were going to get really picky, if I saw a bunch of stuff going on, I might even put the neck down and let her munch on something and have a feel, and same as the neck up. That gets a little bit harder because as soon as you take it out of neutral, then you start activating this lamellar portion of the nuchal ligament, and so you're getting two readings at the same time. So you might want to just be a little bit cautious of the up and down movement of the neck when you're just trying to evaluate this funicular part of the nuchal ligament. So then when we look at the lamellar portion, you can see in the pictures that I put in there, or for you guys that know, we've got these fingers coming off of the top of the nuchal ligament and attaching to the dorsal process of our cervical vertebrae, okay? So right on the very dorsal process of this cervical vertebrae is, or not C2, pardon me, from C3 down, you've got that lamellar portion coming down and attaching in a finger-like manner, okay? Those fingers are coming down and becoming what we're going to call, along with the dorsal portion, the passive system of the neck that activates the back. So when the back, or pardon me, when the neck and head go down, the back naturally comes up because the nuchal ligament itself is going to run all the way down till we get to the middle of the wither. Then they're going to rename it and they're going to call it the supraspinatus ligament, and it's going to come down and attach onto the front of that SI joint, okay? And so this is one unit here, and it's quite non-elastic. So when you look at this structure, it doesn't have the elasticity that some ligaments, so you hear the word ligament and you think to yourself, okay, well, it's got some mobility to it, okay? But it in a horse does not have that much mobility in it because it is being used as a passive system to activate the back, okay? So when we drop the head and neck down, then because of that passive system comes into play, you should be able to see that the back comes up. Now on this pony we've got some dysfunction where her back isn't as mobile as it should be. But as that comes down, the ligamental structure across here gets tight, and one of two things can happen. So what's happening for her is she is actually pressing down on the wither structure. And if we watch from the front when Cassidy brings her neck down, we actually see that the sternum itself starts to drop down rather than this horse's back coming up, okay? So this horse's back is dysfunctional because the passive system is not working correctly. To get this back to work correctly, we would like to visualize this like it's a suspension bridge. So we've got our pillars of our suspension bridge being our forelegs and hind legs. And then we have the back strung between pillars, and we have the neck as one leverage system and the tail as the other leverage system, okay? If the tail drops down and tucks underneath the body, that is going to pull this fairly non-elastic portion of the ligamental system of the back up.
Can I ask a question?
Yeah, always.
You're doing a belly lift on the horse.
Yep.
Okay, so you're going to be elevating that portion of the horse.
Yep.
Right? Is it always natural that the horse will pull its head down?
So when the ligamental system in the middle gets tighter, the other ends either have to get looser or muscle structure has to hold it in place. So if you had no musculature and just the ligamental system, you're 100% right, Carol. You'd lift the back up and both the tail and the head would go down, okay? And we'd push the back down and both the tail and the head would come up. But what we've got through the rest of the body is going to be all of our musculature system. And especially on a horse like this who has a dropped sternum, the muscles on the underside of the neck through the front of the thoracic sling and into the pectoral region are all over tight. And so that's actually physically being held in that position with that dropped sternum posture. So when that happens and the sternum drops down like that, then the body does not have the ability to use the passive system of the back any longer. And we lose all of that structure to be able to get any mobility through the back itself. And now we're just relying either on back tissue or our abdominal tissue to be able to lift up the torso of the horse. Does that make sense? Okay. So if we go back to our biomechanics for a second, she's like, scratch me, lady. You're supposed to be rubbing, not yakking. So if we look at those pillars themselves, the hard thing about horse biomechanics is, of course, they don't have any clavicle. So when we are assessing what's happening with the horse itself, our first thing that we're going to do when we're wanting to know if the nuchal ligament is working properly is, or the entire passive system of the back to be clear, is to lift up this sternum and see how high the sternum really has purchase or mobility in the body. So because we can see that when you lift up this horse's sternum, you know, her wither should sit way up here, right? So because we have lost that much height, when she drops her back, if this wither was, or her neck, if this wither was this much higher, you can imagine that this ligament system would be pulled over that height and then activate the back. But because her sternum right now is so low, she loses this pillar altogether to be able to get the back to function properly, okay? Then if we look at a lot of horses' backs that have a dropped sternum, if you guys do that within your own body and you drop your sternum down and forward, we start to have to tighten that lower portion of our back to be able to get any balance through the rest of the body. Otherwise, if you just did this and didn't tighten your back, pretty soon you would just fall forward, right? So you have to physically be able to keep balance, as does the horse. And then of course we've got one more factor, and we'll talk about factors later, but we're going to put rider weight on top of this as well, okay? So drop sternum is one of the detriments to the horse's neck, because as soon as the sternum drops down, we no longer have the ability to have that passive system of the back working correctly, and we have a pull at all times on the front of the SI joint. Okay, so if you visualize one more time that we've got a ligament running from that nuchal crest on the skull all the way down the horse's back to the front of the pelvis, okay, right to the front of that sacrum. And we say to ourselves that, okay, so now this front pillar is lower than it should be, so we don't have the leverage that we would like with the neck, okay? And we ask this horse to go on the bit. So the sternum is dropped down and we ask this horse to round and go on the bit. This starts to take this non-elastic or semi-non-elastic. So we lose the ability then for this ligament to actually activate the back because we don't have this pillar any longer, right? So if you visualize a string being strung across something like a tent, and we pull this tent peg up in the middle, everything gets tight, right? But if we drop that tent peg down from the middle, then everything is loose. And that's the same thing that happens to a lot of horses' backs, okay? Is that we have this sag in the mid portion of the back because we don't have the sternum staying up as high as we would like, okay? Soon as that happens, you have constant pull on this SI joint, and the sacrum starts to rotate forward, okay? Once this sacrum starts to rotate forward, you physically lose the ability for the horse to use its second pillar, which is in collection. If we talk about the circle of muscles, should be that the abdominals and the hip flexors collect or contract. The hip rounds, and as this hip rounds, what does it do to this nuchal ligament and supraspinatus ligament? Well, it starts pulling it tight, right? So if we have this pelvis and it rotates back like this, and she says, no, Tina, you're not doing that demo. Okay? I'll just do it with myself. She says, that's too hard for me. My back doesn't work that way. Okay? So if we have the horse come into collection where it turns its hip flexors on and it shortens its underside, I know, bud. Okay? Then this SI joint, where the supraspinatus ligament is attached, starts to rotate backwards. So if you visualize like a string being pulled here, well, what's going to happen in the middle? The back is going to go up, right? And if the sternum is mobile and upright, then it's going to pull all the way forward here to the actual head and neck, or the end of that nuchal crest, and that's where the horse comes round through the top of the neck, and they do what's called telescoping out, which means that the neck actually elongates as everything gets pulled backwards, okay? But because we've lost this pillar in this horse, and in a lot of horses that we see have a drop sternum posture, because we've lost the ability to have leverage over the top of the wither, then the back itself starts to drop, the pelvis rocks forward, and the back becomes tight. Now the back tissue, now this pony will be a little thinner because she's got a little atrophy in there, but the back tissue on most horses, you're going to be looking at 2.5 inches of depth of actual back structure here once you look through your spinalis tissue and your longissimus dorsi tissue, and then we've got some stabilizers, as you guys know, caudal head obliques, or caudal dorsal serrated, cranial dorsal serrated. So once you get through that structure, if it gets tight because the back has dropped down, and you guys can feel that with your own back, as soon as you drop your back down, it starts to get tight. Well, the underside starts to get longer and longer. And you might be thinking, okay, we're talking a lot about back biomechanics when we're supposed to be talking about the neck. But the problem is the neck has now lost all its passive ability to lift up. As soon as we have the back drop down and the underside elongate, we no longer have the back or the neck where it can have a passive way of activating the back and can use its own muscles to do things that neck should do. Flex, come into collection, elongate, all those things, okay? Because, and the reason why we're talking through so much back stuff as well is just as a reminder, this will be a reminder for most everybody, is this long longissimus dorsi muscle coming all the way here from the thoracolumbar fascia, coming all the way down the back, going underneath the scapula and attaching onto our last 3 cervical vertebrae. In some books it's going to say last 4 cervical vertebrae, okay? When you look at that longissimus dorsi coming into the neck, because it is one long muscle, it is segmented with what we call fascial rafes in between, which just means a structure in the middle of a muscle to keep it strong. And if the back is functioning properly, which when we get to backs we'll talk about again, but it should contract in a crescendo forward. So if we stripe her here, we should see that the muscle itself contracts all the way down to the neck. Well, her muscle is being held in contraction most of the time because of the drop that we've got here. So not only when we stripe here do we not see a crescendo effect, but we don't see the base of the neck being able to be lifted up because it is already in contraction because of the shape that her back is in, okay? So when the back goes to round and contract, and we'll really get into this when we do our back section, as it rounds, the pelvis goes under, this long longissimus dorsi muscle with its fingers coming and attaching here should lift this base of the neck up, okay? Which is another passive system of how the neck actually functions. As soon as the sternum is dropped down, and most of the time it drops down and forward, some go directly down, but most horses rock it down and forward, which is what we've got in this pony here. As soon as that sternum drops down and forward like that, then the base part of the neck is held in constricted the entire time of locomotion. It's even on her, when you guys come and palpate her, it's held in contraction just in her passive state as well because of the posture that she's currently in, okay?
Does it also mean that the shoulders are stuck up?
Yes, 100%. So that's a great thing to say, Marian, because there is no clavicle on a horse. So when the sternum drops through there, the shoulders actually rise up, which from a rider's point of view, the elbows also rotate slightly out on 90% of them. And from a rider's point of view, then you don't have the ability anymore, number one, for full extension and protraction and retraction, and you don't have the ability to actually mobilize through there. So if you were going to come around a corner quick, or you wanted to set them back to be able to do a roll back, that is stuck forward.
And you can't get the knees up and jump.
Yeah, exactly. And they have no ability to actually fold either, because that is stuck down so hard. And as well, because the base of the neck is in contraction, you also don't have any ability. So like for you, like going over big jumps, the neck actually has to be used as leverage to pull the arc of the jump up and over to get a proper bascule. So those horses that jump in the air like that are because of how that base of the neck is being affected by that long back tissue. Okay, so this is go ahead.
Will the pole also be tight?
The pole will be tight, yes. The jaw will be worse. So we will talk through that in a second, but you're 100% right, Carol, and I see where you're going with thinking about that, because obviously if this nuchal ligament at the top here and supraspinatus ligament is being pulled over a larger surface area, then, not only, and of course larger surface area because we have that sternum drop down, not only do we have constant pull here, but we have constant muscle contraction at the top to be able to balance that head, because that's the other part of the biomechanics of the neck. That we will come back to this lamellar part in a second, because this fits in perfect right now, is the height of the horse, or weight of the horse's head. So a horse's head is an immense amount of weight, like with no soft tissue in it. If you guys haven't picked up a skull before, and this is only a 15-3 hand horse, so make sure you have a little feel of that. Because you can imagine it would be like holding a stick with a great huge rock on the end of it, okay? So they've got this great huge rock on the end of a stick that they're trying to balance. And when you don't have the passive system of the back working correctly, then they've got to use musculature all the time to be able to stabilize their head, okay? Heads are also really important for us to evaluate when we're looking at heads and necks, because the nervous system has the righting reflex. So we are always trying to right ourselves on the line of the horizon, okay? If your horse's neck, and we'll talk through a little bit more lateral in a second, but if your horse's neck is, head is slightly off to the side, the body will right themselves to be able to keep that balance, okay? So if you have a horse that is using musculature contraction in its first and second cervical vertebrae because the nuchal ligament doesn't have the structure or strength that it should, then you're always going to have a horse that is holding their head and then trying to balance towards the horizon as well for that righting reflex, okay? So if you're in tension and the horse is trying to stay balanced with the horizon, which is what the nervous system always does, you're going to end up with multiple layers of rotation through that cervical spine. And that's where it starts getting more and more and more complicated, okay? So if you have one that won't turn, or you have one that when you look at it and you're doing your evaluations won't turn, the first thing that I go to is the face and the balance of the eyes, because that'll tell you right away if you've got something that's not right and that they're consistently trying to balance themselves out. Especially if you have one where the entire face is tightened all the way back. So not only is the eye height different and the nostril height's different, but when you look straight onto it, which we'll talk about assessment in a minute, or in a while, when we look straight onto it, that the eye appears to be pulled back further on one side than the other, that is consistent muscle contraction. Could be a tooth problem as well, but usually consistent muscle contraction in that cervical vertebrae to be able to hold and balance the skull on the end of that long stick or the neck. Okay? All right, so that fit in there perfect, but we didn't finish talking about the lamellar part of that nuchal ligament. And I really harp when I'm talking about biomechanics on that portion, because it is what allows the entire neck to function and the back to function properly. So if we have that lamellar part of the nuchal ligament coming down and attaching onto the cranial border or dorsal process of our cervical vertebrae, and we have any type of slight rotation. So the nuchal ligament is right in the middle of the neck, and then we've got our musculature on either side, okay? So if we have any kind of imbalance through the muscle, or like in this horse, you can see how tight she is here at the top of her neck, or they're overusing that portion of the neck. When the body is trying to be in a passive state, just a relaxed state, the lamellar part of the nuchal ligament does not have a balanced structure to work on. And it's coming up here and melding with the top, the lamellar portion of that nuchal ligament is coming up here and melding to the top of that funicular portion, and then it is turning into that supraspinatus ligament. Okay, so it's all coming together up top. If you have musculature contraction on one side, or you have a slight rotation in that cervical vertebrae, you no longer have neutral, which when you're trying to get a horse to release or work properly or have full range of motion, they have to be able to find that neutral state. Otherwise, they won't have that full range of motion. So you see those horses that take one stride that's a little bit long in front one stride that's a little bit short in front, then the retraction of the opposite leg is also going to be short, okay? If you have a neck that doesn't have a neutral and it has a rotation to one side, and because that is going to affect the way the back works, then you have unequal pull all the way here from the wither itself, and the rotation just continues all the way down the back. Okay, so that's really important to think about, because if you have something small up here, it's going to be reflected in how the horse is able to use its back further down. And you guys have felt that in riding as well, right? If you have a horse that won't turn to the left and everything's tight on the left, well, it's always the right hip that is swaying to the outside, right? So you will dysfunction through the nuchal ligament create a hunter's bump, and yes, 100% it will, because the more that it pulls forward, especially because there's a huge pad of fascia here, your thoracolumbar fascia, and the more that that sacrum starts to rotate forward, the tighter that fascial region will get. And so you'll see those horses that have the little bit of a mountain here, and then the dip, and then the problem in the SI joint, and that not always. You can have an SI injury for sure. Today we're focused on the neck and what the neck can do. So yes, could you have a chicken and the egg? Which one was the injury and which one came second? But yes, you can have a neck problem that 100% creates that. And we would know that by looking at mobility. So if you said to me, okay, well, how do I decide what the chicken and the egg is? If the horse is 25 and been like that for 20 years and there's a lot of fibrosis and arthritis, it's going to be really hard to check. But if the horse is mid-age, functioning, in work, when we start doing our range of motion stuff on the neck, and then of course once we do it on the pelvis on our last mentor meet together, you guys are going to see that if one area has mobility and the other has crepitus in it or stagnancy in it or doesn't have full mobility, then you're going to call the one with that restriction in it older than the one that still has mobility in it. So that's how we're going to decide when we're going to go back and forth. And some people might say, well, who cares? We've got both problems now. Well, the thing about healing, and most all of you guys know this, is that you have to start usually from the outside of the onion and work your way into the middle of the onion. If you're like a sensei and can do amazing stuff like that with one needle, you could maybe start in the, at the origin. But it's hard because not only do these guys have their own locomotor problems, but then we're going to put saddles on them, which is a static object stopping full locomotor patterns. Then we're going to put our asymmetries on top of them as well. So the onion on horses gets larger and larger and larger as we go.
Good stretcher.
Yeah, she's a good stretcher. Her kid does her stretches very well. Okay, so is that a good description? I know that's a long description of Oh, you know what we didn't do? And I'll get you guys to practice this when we have a little bit of horse time. But the thing that we didn't talk about is melding your fingers in and just showing it on the horse here at the attachment of that nuchal ligament onto the nuchal crest. So finding that nuchal crest, everybody I'm sure is familiar with that, but let's just talk it through just in case, right? I always find my nuchal crest, if I have a horse that's hard, is take my fingers pointed up, and I'm going to go ahead and run up until I literally can hook my fingers on it. I personally am not a fan of going from the backside because I've had horses with so much fibrosis up here that you literally cannot tell what's bone and what's not bone. Whereas if I take my fingers and run up, just like if I took my fingers on this guy and run up, even if my nuchal ligament behind here has all kinds of fibrosis, I'll still be able to hook my fingers on the top here, okay? And I'll always know where the bony structure is because then I'm going to run my fingers in and trainers and body workers should do this. You're going to run your fingers in here and you're going to see what you can feel. Is there fibrosis only on one side? Is it on both sides? And when we're talking about fibrosis, if some of you guys don't know that feeling, it's that grainy, gravelly feeling where in between the striations, whether it's a muscle we're talking about or the striations of a ligament, where calcium has been laid down in between there to splint that area. So you're feeling a gravelly, bumpy, stringy type of feel when you are bumping up and over the top of this. So again, I always find my crest that way. I personally then, once I know where my crest is, I take my flat fingers and I'm going to meld in here, and she'll be a great one because she's pretty soft on the right hand side, but she's got a huge amount of fibrosis on the left hand side. Okay, so this is a really good example of what we can see in a horse that has a lot of fibrous tissue. And if we look at her posturally, it also makes sense that she doesn't have the ability to use that nuchal ligament the way we would like her to be able to activate this back. Okay? Okay, is that a good description nuchal ligament wise? Okay, I know it's a long one, but for me I think it's really, really important.
The nuchal ligament also runs sort of in a channel. Is it possible that it pops out of that?
Well, it's pretty fatty. So what Carol's describing is the gristly-like structure that nuchal ligament sits in. When you do a dissection, if you ever get a chance to do it, once you take this rhomboid tissue off here, which is this triangular shaped guy here, once you peel that rhomboid tissue back, you've got a significant layer of fat that sits in there. So there is not an opportunity, even I've dissected really crusty Cushing's horses, and the fat literally just keeps piling on the top of that. So you can have fat on the top of your nuchal ligament even, and of course it squashes out the side. Everybody's seen those big bulbousy ones. But it would be pretty hard for it to literally come out of that channel because of how much fat is packed in around it. Yeah, so that'd be a hard one. Okay, any other questions on nuchal ligament? Quite important that we really understand that, or otherwise you won't understand how the neck works passively. And if you don't understand passive, then to see how it moves actively is not.
Just giving you an example.
Is she? Okay. All right, super. So then let's talk about our atlanto-occipital junction. So when we look at the horse itself, got this guy backwards, we are going to be able to palpate from the outside that jugular process that's coming down, and be able to know exactly where this joint surface is. And it's also really easy to palpate the wing of the atlas on both sides. When you look at the back of the skull and you look at the horse's occiput, we obviously have a very large surface area here, and funnily enough they actually don't get a lot of arthritis in this area because it was very well designed, because they're meant to have their head down all the time eating grass, right? So very well designed as far as the structure through here. The studies that are out now though, with horses with problems in their poll, they're doing more and more injections into the nuchal ligament than they are actually finding that injections into the atlanto-occipital junction actually are making a difference. So that's kind of an interesting thing. What happened to that guy, hey? What happened to that guy? Hey? I remember him. Exactly, this is why you stretch. Okay, so when we look at mobility through here, this is our yes joint, right? So whenever we evaluate it, we're going to bounce and do our yes motion through here. Most of you guys know how to do that really well, but I do think one of the things that we forget is looking at the actual mobility of that yes joint versus what's happening in the jaw itself. So let's just talk through that TMJ joint quick to make sure that we have a good idea of what's happening there. And then before we leave the head, we'll make sure we talk through our hyoid apparatus as well. So the TMJ joint is palpable from the outside, and I'm sure most of you guys are familiar with palpating it, but we're going to follow the zygomatic arch back until we fall into the hole between it and the mandibular process, and that's going to be our joint surface. And I'll just show the width of it before I put the skull together and show what I just did there. The thing that people really forget is how wide the TMJ joint is. They think that, you know, we're palpating here on the outside and it's just this little tiny joint, but we've got a great wide surface that joint sits on. Okay, sitting in the body, having that entire surface area to be able to articulate on. And of course, if we talk about the perfect way of the mechanics of the mouth does not open and close like this, or it shouldn't. It should go in a circular pattern. And if your horse is fully functional in its jaw, it should circle a certain amount of times one direction and then start circling a certain amount of times the other direction. So if we are watching our horse chew and we're not seeing that circular mobility in the jaw, then we actually have dysfunction in that jaw because they are not supposed to just chew straight up and down. So that is something else to evaluate as a horse owner, but also a body worker. If you see them in their stall and they don't have that circular pattern through their jaw, we should really be able to see that. Now this is probably going to be, first we're going to do the glide. So when we are doing our evaluation for TMJ joint, Okay, again, lots of you guys will just come in and palpate through here and just look for fluid and look for pain response, which is cool. That's a great thing. But I really want you to be able to hook your hands on the back of the thumb on the back of the ramus and push that ramus forward. Okay, so if you take the bottom of your hand on the bottom of their jaw and you take your hands and you're just going to push downward and forward, and we'd like her neck to be kind of straight when we do this. And we're looking at opening up that joint surface and seeing if there's any pain there, okay? So lots of guys close that joint surface, and that's a good evaluation as well. But if you try to open it, as soon as your horse comes on the bit, the bottom jaw slides down a little bit. If you have no slide in the bottom of your jaw, when your horse goes to come on the bit, that's the horse that is always coming off the bit, always having a hard time staying there, not only won't stay round, but also won't keep their head in one position. And so that bottom slide, so down and slightly forward, is a really good evaluation to know what's happening in that jaw itself, to see when the head comes on the vertical, will that jaw drop down, okay? And that, for a lot of riders, of course, is skill level as well, but a lot of horses won't allow that to happen. So that's a very important TMJ evaluation while we're going through that structure. There is quite a few studies on TMJ itself in humans, less studies in horses, but there is some good information on the hyoid bone itself, and I think that's something that really needs to be talked through when we're looking at what's happening in the horse's head and neck. So the hyoid bone is the bone that is going to hang the tongue. And so if this is a good visual, these are going to be your lingual processes coming down here from the back of the TMJ joint. So it literally sticks right on the very back of the TMJ joint, okay? And that lingual process is going to come down and hang the bottom part, which I'll show you in a second. And of course, there's a lingual process on both sides of our TMJ joint hanging down this basihyoid. Okay, and so this is your basihyoid. This is the bottom part of that lingual process coming down like this, and this is in the middle of your horse's tongue. Okay, and so this is hanging your horse's tongue in your jaw. And this part, you can actually feel the bottom of it from the underside of the horse's jaw. And this is a critical thing for you guys to evaluate, both riders and body workers, because your hyoid bone has muscle structure that comes down and attaches onto the shoulder. And you've got muscle structure, your omohyoid coming down onto the shoulder and your sternal hyoid coming down onto the sternum. If you have a horse with a dropped sternum, then because the sternum is pulled longer, you literally have pressure on that jaw all the time, okay? So any horse that's in this shape, with this drop back, any trainer will tell you that when you get on it, the first thing they do is shove their jaw out like that, okay? And why do they do that? Because there's pressure on that hyoid bone all the time when the sternum is dropped down, okay? It's a simple physics problem if the muscle is pulled over that larger surface area, okay? To palpate it, we're going to put our fingers right in between the two ramus of the mandible, and we are going to be able to, now there's soft tissue over the top of it, this isn't just poking out, but there is a firm spot in the bottom there that you guys are going to be able to palpate and move around, okay? And what I want you to do when you go in there is when you put your finger straight in there on the inside and you turn your fingers towards the jaw, okay, that's your pterygoid tissue. That's a muscle that you can palpate and see if there's pain in that pterygoid tissue, okay? But I want you to put your fingers in, and I want you to take the back of your fingers and I want you to push the basihyoid to the opposite side. When you do that, if you can imagine this structure again, sitting in here. Okay, when I push it to this side, it's going to jam that lingual process right up into your TMJ joint, and you're going to have a very good evaluation of the pain on the inside of your horse's TMJ joint, as well as if there's any structural pain in that hyoid apparatus itself. Okay, so you want to take your fingers in again straight, and you want to push it away. The reason why I personally don't have people go in with their fingers this way and push it away is because you will get multiple planes of action, okay? So if I put my fingers, back of my fingers in and just push, all I'm doing is pushing it to the side. If I take my fingers and push them in like this, I'm going to get some rotation, and so I'm not going to get an evaluation of what's happening in the opposite TMJ joint. I'm going to get an evaluation of what's happening in the muscle structure of the basihyoid, so both the hyoid muscle as well as if there's tongue pain. And there is a lot of horses that have actual tongue pain. You guys are going to do that with my little alligator fingers to be able to evaluate the actual muscle structure attachment. So first we're going to do TMJ by pushing that basihyoid away. Then you're going to actually palpate the muscle structure itself to see if there's anything going on in there, okay? So really important to be able to do that. And again, any horse that has a dropped sternum, when you palpate in here, is going to have a pain response, okay? As soon as that sternum is down and forward, they're going to have a hyoid restriction and pain, okay? Does it mean that hyoid is our primary? Well, we would decide that through a little bit of range of motion, and we are going to get into sternum range of motion in the next section. But as far as range of motion goes here, it is literally what we just talked about. Will that hyoid bone go lateral and back to you? And then we also want to look at it when I've pushed it to the side and allowed it to come back, and then I have my hand on the other side and I push it to the side. Then I'm going to see if I can go ahead and drag that forward. Some of that you're already going to have a bit of an idea of by opening up that TMJ joint when you had your hands on the ramus itself. But you can hook your fingers on that basihyoid and push it forward and see if you have a restriction in the actual tongue itself. This horse has a true hyoid restriction. As soon as you put your fingers in there, she's like, no thanks, I don't want that at all, okay? But not so much a tongue reaction. When I push down, I can go pretty hard, and we don't have much reaction through there, okay? So that's a really important thing to palpate and see what you've got going on, okay?
When you were doing that,
yep.
you're talking down and forward.
Down and forward, following the path that the tongue would be on in the body. That's a great question. The other thing just to mention right here when we're talking about tongue, because we're getting into a little bit of mouth, is that we have to remind ourselves that the teeth are highly innervated in the socket that they sit in. And so if you have a horse with mouth pain, tooth pain, or tongue pain, you will end up with some neurological signs when you are working through that horse, whether it's a little bit of ataxia, whether it's the way they move their head and neck. I'm not talking that they have a neurological problem. I'm just talking about that they'll have some deficits if there is pain through the teeth, because the teeth have a huge amount of feedback that goes into the nervous system. So that's something to remind yourself as well when you're doing all this jaw evaluation. Yeah, she says, I like that. I like that downward pull on the tongue. It helped me. Okay. Okay, perfect. So C1 we talked about is our yes joint. Okay. Now C2 is our one where we're going to see our most problem area. So we when we look at C1 and C2, this is, of course, our rotational aspect. And people think that most of the rotation in the horse's neck comes through all the vertebrae, but that's not correct. You've got most of your rotational ability of the neck through your C1 and C2 joint. If anybody wants to know the percentages of that, look in Dr. Hilary Clayton's book, The Dynamic Horse. She's literally got the percentage of movement of every vertebral joint in the body listed in there. So that's a really great resource for anybody that wants to know that information, okay? The reason why we really concentrate when we're looking at C1 and C2 is because of that righting reflex that we talked about already. So I always keep my hand on the top of the C1, and I take my lower hand and cup the jaw, not grasp, but just cup, because most horses don't like the grasp, and then start with a little tiny pole nod, and then see if you can increase that. I always love the visual of taking, if there was a pencil, maybe if we did her straight, then these guys behind can see. Carol will be able to see a little bit better too. If there was a pencil coming out the very bottom of the nose, you would like to see which way the pencil is drawing a line. So you just have to get them nodding, and you want to do that nice and passively so that you're not forcing anything. And she's looking around just a little bit, so we'll just let her kind of settle into it here. Okay, and can you guys see those guys that are more at the front? Can you see that her pencil would be scribing a line that's going like this? Yeah, she says, okay, Tina, how much nodding do you want? Yeah, see that pencil going off to the side? Okay, so when that's happening, then we know that the shortening is going to be on the right side because the jaws, or pardon me, the upper head is being pulled to the right. So we're getting that little pencil nod going off to that right-hand side. Which also goes a little bit with what we were finding in the nuchal ligament as well, because it's opposing in the opposite nuchal ligament. Okay, sorry, I forgot to do that. I just realized because I was going to talk through the eval of C1 and C2. So when we look at the rotation in that C1 and C2, the best description I've had given to me is that the horse is doing that, huh? You know, when you don't quite understand something and you rotate your head, but you also lift it a little bit, that little bit of a huh action, okay? That is the true action through this C1 and C2. So I always do this one with my hand underneath the jaw. So we're first of all going to locate where C2 is. So we're going to follow the wing of the atlas all the way around until that wing of the atlas disappears. And then we know that's the depth of our first cervical vertebrae, following that wing all the way down till it disappears. And then once we have that guy disappear, then we know that this is the start of our C2. If you're really good at palpating, you'll be able to palpate the dorsal process of this C2. But the kicker with that, and this pony is a great example, is if they've got quite a bit of fat up there, and she's by no means, she's in lovely shape, but she does have a little bit of fat by her nuchal ligament, and it is a little bit harder to find. So I always take my little karate chop hand behind my wing of the atlas and come down and find the spacing where C2 is going to end and our junction between C2 and C3 is going to start. I take my arm and put my arm right there on C2. I take the bottom of my hand underneath the jaw, and then I just go for that huh action. So we're actually getting that rotation rather than turning her to the side, right? Because that's just going to be lateral mobility. We want to physically see, will that head rotate from side to side? And obviously it's only pertinent as to how it rotates on this side versus how it rotates on the other side, right? You want to really be able to see that those two sides are able to move equally. And have that full range of motion. One thing to talk through with C1 and C2, sitting on the top of those is that caudal head obliques, and then under it you're going to have that little flat ligament of your longissimus tissue, that your longissimus capitis is going to be the flat guy, and your longissimus atlantis is going to come off the bottom. So that little flat spot, lots of people get really confused that that's a problem in the horse's musculature, but that's actually that ligament shaft sitting there of longissimus capitis. So make sure that that doesn't fool you. But you'll see on this horse that she's got all kinds of tight tissue through your caudal head obliques, and that is definitely indicative of a back that's not functioning as well. So if you have a lot of lumps and bumps, if you're just starting in your bodywork career, or like your trainer that's not doing body work, if there's a lot of lumps and bumps here, then you right away, well, it can be that there's a problem in C1 and C2, but right away we start thinking about that passive system of the back. And if I saw that, my next palpation would be behind that pole, right? Just to make sure that you don't have some kind of crepitus or fibrosis that's starting in behind that pole, okay? Now, the rest of the vertebrae are really important to talk through how they move, okay? Because lots of people think that when you're evaluating the vertebrae, that you're going to go ahead and bounce along. And it's really important to realize how these guys come together. So when you look at your articular processes of your cervical vertebrae, they are a flat disc shape that is going to match up with the opposing vertebrae. So the vertebrae that's in front is going to sit on the top. The vertebrae that's behind is going to sit on the bottom. Okay, these guys have lateral mobility for sure, but when you're evaluating them, I see so many body workers going through and just pushing on the lateral surface of the vertebrae, but that is not how you're going to evaluate. If you guys look at the angulation, I don't know how this is the best, just walking around, I think. If you guys look at the angulation that the articular processes sit at, it's really important to see that they're not flat, that they are on a significant angulation in there, okay? Yeah, especially on between 3 and 4. They get a little flatter as they go through, but they always stay on this angled plane. Okay, so when we evaluate these, you guys see that angulation that sits on, that it's not flat. When we evaluate these, we have to evaluate them on that angled plane. You can't just push these from side to side and think that you're getting a good idea of what the vertebrae are doing. And the other thing that we have to talk through is when one moves in the chain, you're going to get some slight movement in the next one down. So sometimes when you evaluate one of the cervical vertebrae, it gets a little confusing as to what you're actually feeling all the way down the cervical spine. So to be able to isolate them, it's best to do them in a little bit of an activation style to make sure that you're actually getting a good feel of what's happening. So when we're going to find our cervical vertebrae, we just have to talk through our musculature a little bit. And then the other thing we have to remind ourselves of is that lamellar part of the nuchal ligament coming down and attaching onto the dorsal process, because sometimes the vertebrae won't move, not so much because there's a problem in the vertebral surface, but because the back is so dysfunctional, okay? So always remember that the mid portion of the neck has a direct correlation to whatever's happening in the back itself, okay? So first, let's talk through the core muscle that goes around the cervical spine, because that gets a little confusing for people as well. So you've got your multifidus muscle that's going to run on the very top of your cervical spine, okay? It's going to be that rope-like muscle that's going to go from the articular process of one to the dorsal process of the next, and then skip a vertebrae, and there's going to be another branch of it that comes down as well. In the back, it actually skips 2 vertebrae, and you have the 3 branches, okay? So you've got these multifidus muscles sitting on the very top of the vertebrae here, making a little bit of a rope shape, okay? Then in between your vertebrae, you've got your intertransversarius muscle, okay? So you've got muscle when you find the spaces in between your vertebrae. Of course, you've got your big strap-like brachiocephalicus and omotransversarius sitting on the top of the vertebral surface, but if we're really evaluating vertebrae, we need to know what we're looking at with the musculature in the core itself. And so in between the vertebrae, you've got your intertransversarius muscle, okay? Then on the underside of the vertebrae, you've got the suspensorium, which is your longus coli muscle. And this is absolutely critical for how the sternum sits in the horse's body, okay? So your longus coli muscle starts on your thoracic vertebrae, okay? It makes the suspensorium underneath, okay? So a little hammock, if that's a good word, okay? A little hammock underneath there. And then it's going to come up and it's going to attach on the underside of the cervical vertebrae. If you have a horse that has a drop sternum, okay, that muscle is literally always going to have tension on it, okay? That muscle's job, unfortunately, is to lift up the sternum, okay? If that muscle always has tension on it and it's always tight because the sternum's dropped down, then you've got your second problem biomechanically for why the horse can't lift its sternum or base of the neck up anymore, because that muscle itself is under pressure all the time and it doesn't have the strength anymore to be able to lift up. So that longus coli muscle is really important to us, okay? So many people in their evaluations come and they squeeze brachiocephalicus like this, and they say to me, okay, well, I've got a shoulder problem. But they forget that when they put their fingers underneath here, you're also palpating hyoid tissue. And then if we actually put our fingers straight in and up, that is directly on that longus coli muscle, okay? And that muscle is going to be on fire on this little gaffer and anybody that has a drop sternum, okay? So if you stroke that muscle, you're gonna get that pain response through there. If you have a horse that will not lift up in front and you're riding it and they have no mobility through there, and you stroke through there and you cannot get that muscle to fire, so like here when we stroke through, we can get any muscle to fire when you cross the fibers of the muscle structure. If I stroke through, so muscle fibers are going up and down, if I stroke through on a little bit of an oblique angle, I should be able to get that to fire. On a horse who had a functional sternum, if I was to fire that on both sides, okay, so she's a little bit too little for me and I'm going to stand right with my back to you, but just for 1 second I will. If I stroke through here, that longus coli muscle should lift that sternum up, okay, but she doesn't have any ability to lift that up. So you can easily see biomechanically how a horse who had a dysfunctional problem, whether it was ridden in or they had an injury or something happened to them, once they get that sternum down, to get that sternum to come back up and be actually functional is really, really difficult, okay? It takes a ton of work and it takes a ton of activations to be able to get it to fire, which is what I want to kind of go to next, is just to show you guys that just an example of what activations can do. So you guys just saw me stroke that longus coli muscle. We went through and she was not able to lift through here, okay? So if I want that muscle to be able to turn back on, okay, and get it to function, I'm gonna do my activations on the underside of the sternum, okay? So I'm just going to, and as we do this, I'm just gonna remind everybody of what an activation is. So an activation is where we are going to get a muscle to fire over and over to start to be able to actually function how it's supposed to function. So the nervous system is a bit of a rascally rabbit, you guys.
Can you just explain exactly where you poke her?
So I'm just going, yeah, no, that's good. So I'm just putting my fingers literally right on her sternum. And when I do an activation, I like to have an active finger. So I'm literally going front with one hand and back with the other hand. And I'm just doing that over and over so that she will pick up. That's super, Marianne. Okay.
Have one that literally doesn't even react to that.
Well, they might bite you.
Yeah, or they might bite you, or they're so turned off. Yeah. And so if they were that turned off, Cindy, I would start somewhere else with my activations, because if the body is literally that turned off, and we might as well talk through some nervous system function here as well, but if they're literally that turned off, then the body is going to be protecting in another location, and we can stimulate the nervous system through there. So we'll just chat about the nervous system here in 1 second. So when we're doing an activation, we are asking for a movement the body is not able to do, and we're asking them to do it in a repetitive fashion, and we're doing it between 30 and 50 times, okay? And the reason why we do between 30 and 50 times is because the research is going to tell us that the nerve itself will not recognize that there is an ability for that muscle to fire correctly unless you give it that information. And that is like a whole lecture in itself for sure. But 30 to 50. She's like, I'm out of here, Tina. This sucks. Yeah, you bet. So, she's like, get away from me. I hate you. Okay, so I'm just taking my fingers underneath there and I'm going back and forth and then I'm moving my way out. And I always use an active movement when I'm doing an activation because I need the body to physically turn that muscle on and all the way off. So if we just talk through just a snitch of muscle physiology, when a muscle is in contraction, okay, so here's your striations of your muscle and it's in contraction, okay? When it is contracted at 70%, there is no more blood flow in or out. Okay, so you know that crunchy, horrible stuff that we've all got between our shoulder blades, okay? That is where there's enough waste products and fibrosis stuck in there that we don't have the circulatory response that we normally have. Muscles can stay contracted and not release all the way. So let's say we talk about this bicep muscle. This is all the way turned off for me currently, and this is, turned on for me currently, and this is all the way turned off for me currently. Muscles themselves can get stuck at a certain point, especially if they have a nervous system recognition of that point. So let's say I had broke this elbow, you guys, and this elbow was in the olden days, they don't do it like this anymore, but in the old days, they put you in a sling, right? And this elbow just stayed in this position the entire time, right? When you then went to move it, you had very little movement up and down, and it's not because you had a structural problem, like there was an injury to the muscle. It's because the muscle itself had shortened in places and elongated in places. And so it literally doesn't have the same contractile function that it used to have, okay? Now the research has told us over the last few years that if we repetitively tell the muscle that it can turn on and can turn off, it will start to recognize that it has that pattern and it will actually be able to function normally. Now, muscles have memory. So if you had broke that elbow and you did these little activations that I'm going to show you again on her, okay, and we did these little activations and we got it moving, then I might say to myself, wow, I can move this joint to here. But the memory of that muscle is that it only came to here. So after a certain amount of time, and that's person dependent, or nervous system dependent is a better way to say it, because this goes over any muscle, dogs, horses, hamsters, anybody, okay? You will all of a sudden the next day wake up and be like, oh, that worked yesterday, but it doesn't work today. But if you start your activations on it again, the body will recognize that it has that movement and the range of motion will get greater, okay? So on her case, she has a muscle that is turned on, okay? This longus colli muscle is turned on because the sternum has been dropped down. When I do these activations on her, and I might need to do a couple more, but we'll try just to see how turned off her muscle is. When we do those activations on her, I should be able to stroke in here, and if the longus colli muscle had enough activation and the nerve root that is in it recognizes that it can function and actually contract more and not just live in that static state, we should see that this wither pops up. So then you can see that that wither pops up just from activating that longus colli muscle, okay? And if we did it on both sides instead of one side, like I showed you before, she's like, I'm getting sick of you. Okay, If we do it on both sides, okay, you can see that that comes up, and now her neck actually is able to lift up again as well. Okay, so as a body worker or trainer or anybody that's a professional in the horse industry, when we recognize dysfunction, the research is really telling us that we need to go and find what muscle or area is not functioning properly, start to retrain the nervous system to be able to function properly, and start to see that the body then can utilize that muscle that it hadn't used before. Now, when we leave tonight, if we just did those 20 to 30 activations, she is not by any means fixed, right? Her passive system of the back still doesn't work. When we put the neck down, the back won't come up, all those type of things. So then it's about retraining the nervous system long term. So this is homework for your clients, or if you're a trainer, homework to do every day to start to activate this area to actually make that change, okay? And they really want that 30, the research is really telling us that it needs to be that 30 to 50 reps to actually be able to get the nerve to recognize contraction, and not only contraction, but also relaxation, which is sometimes as important. Because this horse, living in contraction all the time, then when we get her to utilize her sternum differently, then she also has to retrain other areas that were held because of that, right? So, you know, like if we were going to get into the back, which tonight we're not, but if we were going to get into the back, then we'd say to ourselves, okay, well, not only is she dropped here, but she's also dropped here, and she started to rotate forward in her pelvis. So then we would look at activating all of those areas to start to retrain the way she's able to function. And if we were going to use our Rainbow and Sunshine Land, the function would not only be before we get on, but you might need to hop off and do this, or have your client hop off and do this partway through the ride to reactivate your area to actually be able to get long-term change, right? And Carol's laughing because there isn't very many clients that are going to hop off halfway through their ride and be able to get the activations done again and then get back on. But that would be, if you were a nervous system guy, that would be where we would really want to see that change.
In your experience, how often would you do the activation? Now, you said hop off, do it between the rides, but I mean from sequentially day by day. Every day? Every day,
yeah. Every day until you start to see a change in the posture itself.
And you would noticeably see the change in terms of the behind the...
Yeah, exactly. The shape through the... Yeah, exactly. The shape through the front of her chest, the dip that she holds here, and the shape behind her wither. Yeah, yeah. And we'd also need to do enough to outweigh some of the factors that she's got going on. So meaning that if she has a terrible saddle, she doesn't, but this is just an example. If she had a terrible saddle, then every time the saddle goes on, the muscle memory goes right back to where it was, right? So all the nervous system work that you did is now negated, because the nervous system's number one job is to keep us safe, right? And so as soon as that pressure is put back on by that saddle, okay, now her problem isn't saddle, her problem is little people that are riding around, you know, and just having a grand old time, but don't know how to get around, right? So that's good for her to be such a fun pony to be able to do that. But if this was an adult's riding horse, then we would want to actually see them do that enough that we could start to see a postural change. Okay. Okay, one more thing about the shape of the neck and that longus colli muscle, okay? So that longus colli guy on the bottom here, making that suspensorium and coming up onto the rib cage. As soon as you have a rotation in your thorax, you are going to have that go through to the neck. There is no way around it, okay? So that is something really important to think about. If you have this muscle that is making a flat shape from your rib cage coming up through that sternum and cupping the bottom of those vertebrae, if you have a rib rotation, that is going to affect the way that muscle can contract on both sides, okay? So important too then to think, okay, well, so I've got this neck problem and I've got a little bit of a rotation here. It's not going to be just isolated in that neck. We also need to evaluate the ribs, which we'll talk about more on back and thorax day on how we evaluate the ribs, but that's important to think about. Okay, we got off on a little bit of a rabbit trail there, but we do want to go ahead and actually evaluate the cervical vertebrae. So we talked about how to find. Yeah.
You can also absolutely have it better from the side.
Yeah, perfect.
Thank you.
Yeah, you bet. So when we're going to evaluate your cervical vertebrae, we already talked about how to find 1 and 2, but we're going to walk our way through it again. So we're going to follow that wing of the atlas around until we feel that it disappears. That's going to be the back of C1. We're going to put our little karate chop hand right there, and we're going to slide down and we're going to fall into the space that is between C2 and C3. C2 is going to be our guy that we just did our rotational evaluation on. Then we're going to go ahead and find the actual vertebral body of C3. And where we're going to evaluate is going to be right in between. Because if we look at where the articular processes are, okay, where the vertebrae are coming together, when I do my karate chop hand, I'm falling behind this transverse process of the vertebrae, and this is the hole that I'm seeing. So when I fall into that hole, that is right where my actual joint surface is, okay, where my two articular processes are coming together. That's where you guys are going to evaluate. You don't push on the vertebrae in the vertebral body. We do for a couple different evaluations, but not for how the actual joint surface is working, okay? So when you guys use your karate chop hand, you're physically falling in between that space. And when you fall there, you know that you are right in the space that is the joint surface itself, okay? So then you're going to find that space. So let's do it again. Wing of the atlas, karate chop hand between C2 and C3, between C3 and C4. So I know that my articular spaces are here. I'm going to take my flat surface of my hand. I'm going to find the top of the vertebrae by running my finger from the jugular groove up and landing on the top of the vertebrae themselves. Find my spacing again, so I know right where I'm going to put my hand. And I've got to go on a 45-degree angle to be able to actually evaluate how the articular process is sliding, okay? So it has to be on a 45 because that's the angulation that the actual articular processes are sitting on, okay? So I'm going to steady the horse's head. I'm going to go, now this horse is, I'm tall enough and this horse is small enough. If she was taller, I'd have to be on a stool. And I'm going to press straight across in a bouncing fashion to be able to see if I can feel any restriction in this vertebrae. And at the beginning, when you're starting, you might say to yourself, oh, well, you know, like she raised her head and she blinked her eye. But we have to remember that it has to be repeatable, okay? So as I'm bouncing here, if I feel something once, then I'm going to say to myself, okay, I don't know if that was real. I need to be able to feel it 4 or 5 times. And you need to be able to go to the next vertebral spot and bounce. And you need to be able to go to the next vertebral spacing and bounce and see what you get all the way down as you're evaluating your vertebral surface, okay? And some of you guys might say, well, how does this apply to me? Like, I don't even know why I would be doing this. If there is a segment of the cervical vertebrae that is not functioning, so it doesn't have full glide all the way across, then you, of course, are not going to be able to have the flexion when that side opens. So it's usually the opposing side that the riders and trainers feel a problem on. versus the side that has the problem. So if I bounce along this little horse, and between C2 and C3 was really sticky, and you can see she's getting a little bit of releases just from doing that little bit of bouncing. And between 3 and 4 was a little bit sticky, not like 2 and 3. And so when I do that, I'm gonna say to this horse owner, and I should say something first. You also need to know what both sides are doing before you decide if one side is tight or not. Because some horses are going to feel tight all the way through their neck, and it's probably because of how they're needing to use their neck as leverage, especially if they've got hindgut ulcers or SI pelvic problems, okay? So it is a caveat that you do need to evaluate this on both sides before you decide that all of a sudden that's a problem, okay? But when we go through there, when I'm trying to push across like that, I'm trying to open that vertebral surface up. So I'm pushing across and I'm opening up the side on the opposing side. Here, let's do it with these. They're standing right here, so let's do it with these. Okay, so I'm on the side that I'm standing on these vertebrae. I know, but I'm bouncing across. And you guys can see that I'm opening up the bottom of the opposing side and the top of the side that I'm on, okay? So I'm evaluating not only the glide through the vertebrae, because we're not chiropractors by any means, we're not gonna be doing adjustments, but I'm also, when I do this, I'm opening up my intertransversaris on my opposing side. And when I'm pushing down like that, I'm also evaluating my longus coli on the opposing side, okay? I'm gonna be evaluating slightly my multifidus layer, the musculature that's on the top of the vertebrae or the cranial surface on the side that I'm on. Okay, so you're getting a lot of information just by doing this. You're not only getting the glide that the vertebrae are able to give, but you're also really getting a great idea of what the muscle structure itself is doing, okay? So I think that's super important when we are chatting through what we're feeling and what's happening. Because then once you get really good at it, when you push, you're starting to decide, do I get stopped somewhere? Is there a specific point that the horse is reacting at? Is it when I very first start, which is probably the top? Is it when I end my bounce? That's probably the opposite side at the bottom, okay? So you can get quite in depth with the amount of information that you're gleaning from doing this on the horse's neck, okay? All right, just a couple factors, and then we're gonna get some horses, and we're all gonna start to have a little look at this, okay? Just gonna. Yeah.
If you're pushing across like that and it's side bending one way versus the other,
yeah,
would you not want to start thinking about what is keeping that side bend on the other side? Not necessarily in articular fashion, but working through it so that you can get rid of that restriction, and then ideally, if you can remove that side bend on the other side, you won't necessarily need a chiropractor, and it shouldn't.
Yeah.
100%.
Yeah, 100%. I love that you're saying that. And I think, you know, to add to that, when you're thinking about, you know, what is the creation, then we would also go with the leverage that's being created by the head. Yeah. And then what we're, yeah, exactly.
My brain goes, but,
right.
Yeah, that's kind of.
Yeah. No, but you're 100% right. If we can then palpate through and figure out what is creating it, then it's going to give us all kinds of soft tissue information as well. When we're talking through our the factors of what else could be affecting the neck, remind yourself of bit fit. Pole bridle fit, meaning is there a way to distribute the weight that's sitting there? So Pete's a bad example that's here. He rides in a big spade bit, and then his favorite headstall is a tiny little braided headstall that's got one braid that just goes over the top. So it's just a little tiny pencil braid that goes over the top. So of course, all the weight bearing of that bit is being sat on the pole without being able to distribute the amount of weight that's there, okay? So you want to think about that. You want to think about any training tools that they use. But the biggest thing that you want to think about for, well, not maybe biggest, there's lots of big things, but with the way the neck is functioning is, does the saddle pinch anywhere along that nuchal ligament? Okay, so, and it would be supraspinatus ligament by the time you got back into the saddle region. But so many people look at how the tree point is fitting, but they forget to look at the width of the gullet or the channel. And when the horse turns, the saddle is literally hitting into that every lateral movement of the horse. And that will 100% affect the way that neck is able to function. So that anytime that channel is too narrow is really going to affect our mobility through the mostly base of the neck, but also through that mid part of the neck. Okay? All right, I think those were my factors that I wanted to get in. Oh, and anybody that hasn't looked at Dr. Dyson's online pain course that is online, is you really should look at that, because jaw and mouth pain are really shown through like the amount of wrinkles that they hold, the amount of wrinkles that sit beside the eye, and she's got some really well documented information on that. And I think that's something that everybody, especially when they're looking at evaluating heads and necks and TMJ pain, should for sure do that course. Okay, so that's an online course by Dr. Sue Dyson. Okay? Okay, super.
Does the OA in a horse act similar to that it can rotate and side bend? Do you ever test?
Yeah, so when you look at Hillary's research on that, she has very little, like I think it's 0.4 for lateral, and I don't have it memorized for actual, it's 0.4 for rotation up there, and I don't have it memorized for actual lateral, but it's very slight when you look at how much actually can occur in there for the lateral rotation of OA. So I don't know how much ours is, because I don't know human numbers the same.
I don't know human numbers either, I just know it happens.
Yeah, so, but she's got very little in there. So our primary evaluation she wants us to do is just the yes. Is just the flexion and extension of that joint surface. She doesn't have hardly any side bend or lateral mobility that is in there. And like I say, the rotation is minimal.